Hello, and welcome to my poster presentation for my capstone project. This is Katie Hammer Tucker, and my capstone project is called Arousal Modulation with Sensory Motor Interventions in K through 5 Students, a paraprofessional training program to promote academic engagement and learning. For the background and need, I highlighted a few different research studies that I found regarding sensory processing differences in elementary school students, as well as paraprofessional training programs and their effectiveness. In some studies done by On et al. And Ben Sasson et al., they found that 5 to 16.5% of all children in the general education setting have demonstrated atypical sensory reactivity responses. In a study done by Tom Check and Dunn in 2007, studying children with autism, they found approximately 95% of the sample demonstrated some degree of sensory processing dysfunction. When looking at paraprofessional programs, Brock and Carter in 2013 found that the studies indicate paraprofessionals, when given adequate training, are capable of effectively implementing a number of educational practices that result in improved academic and social outcomes, specifically teaching communication skills, reducing problem behaviors, and increasing independence for students with IDD. And Walker et al. Conducted a systematic literature review of paraprofessional implemented systematic instruction for students with disabilities. Out of the 13 studies that included student outcomes within the literature review, they found 85% of the students who received paraprofessional implemented systematic instruction experienced positive outcomes as a result. Description of my capstone is that the research is very limited on OT programming to train paraprofessionals on how to meet students' sensory processing, arousal, energy regulation, and emotional regulation needs. So, the purpose of my project is to develop a practical, hands on program geared towards training paraprofessionals on how to proactively meet student sensory needs before a problem behavior or crisis occurs, and to measure the effectiveness of these sensory strategies and interventions for increasing students' educational participation and engagement, and hopefully close that research gap a little bit. Overview of my sensory motor program is multiple parts, and the first part was to develop a Snoozlin style sensory room that you can see in the picture under the outcomes section to the right of this chart. The next was a sensory motor active room. The next is 20 sensory motor stations, and then regulation stations for each pod, especially for the general education students. A Stanley sensory book for reference. The picture to the right is an example of two of the pages in there that include visual icons for our students' visual schedules. An individualized student sensory program template and a paraprofessional training protocol. Outcomes that were experienced from this program implementation were 90% of the paraprofessionals who were trained in this protocol were able to identify at least two things they learned during the training stages. 100% of the paraprofessionals who were trained in this protocol reported they have seen positive results in the students who used the program. The conclusion: the Stanley Sensory Motor Program development was a successful endeavor and has proven to be helpful in teaching our students arousal modulation strategies using sensory motor interventions. The paraprofessional training program has been a helpful addition to ensure good carryover of the methods and procedures. The references are attached at the bottom here, and there's a few additional pictures highlighting a couple of the other stations, including the check-in station that can be used before and after the sensory input that's given, and one of the sensory motor stations, which is the wall push-up and squat station. Thank you for listening to my poster presentation, and I hope you all have a great rest of your semester.